Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches. Today is Monday, March 14th, and I'm here today with Ed Brubaker, Living Branches President and CEO, for a special edition of our videos.
Yes, it is a special edition. I think part of the reason it's special is because we couldn't do it last week because you were camping. Wow, it was not quite summertime yet, but I guess you survived because you're here. But 0 degree camping is probably not my idea of a good time, but good for you.
We may have been slightly optimistic in our assessment of the weather in March for camping, yes. But it's nice to have survived and to be back. Let's start for a moment with our COVID case counts at Living Branches. And we're happy to be able to say that as of right now, it looks like there's only one person who has officially tested positive for COVID in all of Living Branches, and that is an employee at our Dockwoods campus.
Yeah, and it's really nice to be at that place. And when you think about it, it was a little bit more than exactly 2 years ago today that we were shutting down and saying it would be 2 weeks till we could reopen. I think even the governor of Pennsylvania may have said that, instead of saying 2 years. Of course, you need to start gradually, right, to get used to it. But, none of us would have had any idea that this is where it would go. But here we are 2 years later.
Yeah.
The other thing I would say, too, is it's so dramatically different than it was in January of this year. And again, as I've said many times over these last, many videos we've done in the last 2 years, that our case counts internally are directly correlated to what's happening in the community. And community case counts are down.
Yeah.
And so it bears to reason and stands to reason that our case counts are down as well. Regardless of how we get there, we're really glad to be at this place.
Yeah.
It feels good to be here.
It does feel good to be here. And I did check that we sent out our memo on March 12th, 2020.
It was March 12th.
Yes, closing the campus for a few weeks.
Wow.
Yeah,
Wow.
and here we are.
Yeah, here we are.
Well, let's roll out good news today instead of our usual, and let people know that because our case counts are lower, we're able to make some changes to our guidance for residential living, which is our, shall we say, unregulated areas of our campus. So.
Yeah, that's right. And when we think about residential living, some places call it independent living. It's, these people are like you and I who happen to live in a retirement community. In other words, many of them are on and off campus and interacting with the wider community, making their own decisions as to how they want to interact with the world. Some people may stay home more, other people are out and about and have been out and about. And so that's the level of service or the level in our retirement community that we're talking about. The reality is the other two levels of care, health care or skilled nursing as some people may call it, and personal care are regulated. And so we continue to need to follow those regulations as might be expected. We want to get paid for Medicare and Medicaid and we want to do the right thing, of course. And so there's going to be this differentiation that can become confusing to residents too, because there are times, particularly between personal care and residential living, that there may be times of interaction. But yes, today we're specifically talking about some changes in residential living because of the changes in the wider society. And the other thing I would say too is what feels maybe a bit different about this phase than maybe even last summer, because if you recall last summer, I would say, have a pretty good summer, and then right away in September, they changed how they were analyzing things, CMS did. And it was also, I think, in the 5% range. So just in the last 2-3 weeks has been the first time since September of 2021 that we are actually below a 5% positivity. Now, they also added the rate per 100,000 that we need to look at too for healthcare. But those two factors together significantly different. I would also say that I have not been reading anything about any variant on the horizon, like the Delta or Omicron in the past. Now there can be, Omicron 2B1 or whatever, but there's nothing that I've been seeing that it's like, oh, we need to watch this coming out of South Africa or something like that. That is not to say that that won't happen again. We really have no idea where this may go, but it is feeling a little different in that regard. And so we feel that the time is right for us to make some changes.
Yeah. And so the big change that will be impacting our residents in residential living is that face masks are now optional for residents and guests in residential living.
That's right. And that's a key point too, that we're saying they're optional. If someone wants to continue to wear, and these are residents, not staff, but a resident wants to continue to wear a face mask, that is perfectly fine and we support that. But we're saying, if you choose not to, it's not required anymore within our buildings.
Yeah. And the caveat for that is for people who are going into personal care, health care, or memory care, we must follow the guidelines. And right now, those guidelines say everybody who's in there has to be masked.
That's right. And so, yes, that's correct. And even as I said that, I realized that the confusion of coming in our buildings, that if you're going into a residential living area, there's common spaces, that's one thing. If you're going into personal care or health care, the masking policies are still in effect.
And we really haven't, at least I haven't seen anything coming out from CMS or CDC suggesting that they might be loosening those guidelines in total. I've seen a couple of things here or there saying if you're down in the low category of COVID spread in your county, that you could talk about it in an individual private room, but nothing in total.
Yeah, I would agree with that. And with that piece, whether we are, at some point, hopefully we'll be able to make some changes there too, but it almost seems at times that some of the things that are coming out are actually perhaps even getting, I don't know if I'd say more stringent, but more carefully nuanced of things we need to do in healthcare and personal care. So we won't get into the details of that here, but yeah, clearly right now there are no changes happening in healthcare and personal care.
Yeah. And I think the other thing we probably should mention too, I went back and checked. The last time we announced that residential living residents could go masks optional, we made it 7 weeks before our case counts rose again to the point where we had to reinstate mandatory masking. So I guess we'll see how long it lasts this time. Hopefully we can beat 7 weeks.
Yeah, that's right. And I would say, even as you think about where we're at in the pandemic and kind of even what we tolerate, if you will, and saying, oh, well, we're going into this, and somebody said, well, my goodness, there's still a lot of people dying in the U.S., potentially even more than there were last summer, and yet we're relaxing things. And I do not want to minimize whatsoever the people that have passed on. That is very sad, and there's a lot of people that have died in the U.S. from COVID. But I think it's also part of kind of understanding the disease, who does it impact the most, and how do we best protect each other and be as safe as we can while not creating this sense of lockdown and things that are more difficult for some people to do.
Well, we're very clearly going to have to figure out how to live with this as a world.
That's right.
Because it's not going anywhere. So.
That's right. And I would compare, and I don't even know if it's a strategy necessarily in the U.S., but I just read an article again in China that they have essentially a zero COVID policy. So again, 71 million people were put under restrictions in certain areas of China. 71 million.
Yeah.
It's just incredible to think about. But when you say we don't tolerate any level of COVID, you need to get to that level of restriction. I just kind of had to chuckle to myself in my head when I read that, because based on what I see in the U.S., that would be almost impossible to do in the U.S. just because of how strongly people feel about these things.
Yeah. And I think maybe it would be good to give perhaps a word of encouragement to our residents. I know there will be people who are not comfortable with removing face masks, and they for whatever their health reasons are or their family health reasons. They want to be as careful as possible. We have seen repeatedly at Living Branches that being vaccinated offers you strong protection against becoming very ill with
That's
this
correct.
disease.
Mm-hmm. That's correct. And articles I've read, even articles that have talked about face masking and other kinds of protocol that were being used to try to prevent disease, and reflecting on that, the theme and the thread through all of that was the vaccine was still very, very critical in tamping down the level of seriousness with the disease. And we have absolutely seen that in Living Branches. The people that passed away in Living Branches over the last few months from COVID were not vaccinated. Yeah. So it seems to be clear from the data that that is still very important. Some of these other measures are maybe debatable at times, perhaps, but clearly vaccine is still important. On the other hand, I've read articles too about, because of the fact that we have been in this time for such a long period of time, for some people, for who knows, various and sundry reasons, it could be health conditions, it could be other things, are not as comfortable with saying, oh, okay, let's just drop this thing. Let's move on. Let's put COVID behind us. And so part of it is, for me, has continued to be that lesson of how do we continue to be respectful of other people who may not feel that way. For me personally, I'm vaccinated, I'm boosted. I feel comfortable in certain places without a mask. Elevators would probably not quite be that yet. But so I have that level of comfort and the way I do that. Honestly, I've still been wearing it until this past Sunday at church because even though, frankly, most people don't at my church, partly out of solidarity with our policies here in residential living. That's now changing. I may choose to change what I do. But with that said, if someone else feels that they're more comfortable doing that, then God bless them. They need to be able to do that. And if I'm relating to someone who, particularly if I know, and if I don't know, I can ask, but when I know that they have a concern because of health conditions or just because they're concerned and they're about it, I think it's incumbent upon me to be respectful and not force them to be at my level of safety. So if I'm comfortable without a mask and I'm relating to someone that's not comfortable with that, if I can determine that, I think it's incumbent upon me to be respectful and put a mask on when relating to that person. I really do feel that way. But in group settings, we're not going to, walk around, oh, do you feel comfortable? Groups are different than individual meetings or other things like that. So it's something we don't want to force on people as a person if I'm comfortable wearing or not wearing a mask, but we need to be respectful of others and where they're at, because people are at different places on this topic and we just need to have respect.
Final thoughts?
Well, I guess I would say I'm just glad to be at this place. It feels different to me than the past, and maybe that's just partly because we're seemingly getting more used to where we're at. I don't know. But the numbers seem to be good where we're at. Wow, it seems like there's always stuff going on in our world, though. I remember back at the beginning of the pandemic and George Floyd was killed and just all the unrest around that. And you're kind of like, wow, how much more can we take? And then there's kind of political things going on over the last couple years and just so many things that felt like is going on. And now, of course, Ukraine and just this sad situation there. We had an exchange student when our daughter was younger from Ukraine. I believe she's out of the country now, or was when the war started. But yeah, it just seems like COVID all of a sudden doesn't seem quite as important. Still is very important. We need to pay attention. But wow, it's just so disheartening and sad to see what's happening over there. So the news cycle keeps changing, what's happening in the world keeps changing. I really do hope that COVID stays out of the news, not because other more horrific things are happening, like right now is happening, but because it is actually becoming to the place of being endemic. But we will continue to keep watching it.
Yep.
And keep doing what we need to do. But again, thank you to you for these videos that we've been doing the last few years, but also to our residents and to our staff for their long suffering and excellent work on behalf of our staff and long suffering and care and concern over these last 2 years from our residents.
Well, and I will say thank you for good, solid leadership over the last 2 years. It really makes a difference.
Well, thank you.
So, well, thank you to our viewers as well. As always, if you have comments or questions, please feel free to email me at coronavirusquestions@livingbranches.org, and we will see you on a later video. Thank you.